Hi, my name is Cameron Andrews, and I'm the founder and CEO of Sirona Medical. We started Sirona over 5 years ago with the mission of re-architecting radiology IT to allow AI to power a clinical revolution in healthcare over the coming decade.
I've seen a lot of companies come into this space and try to do what we're doing here at Sirona. And I think that what we've done here is really start fresh and start over on a modern platform, and it's something that this industry hasn't seen before.
Sirona wants to give radiology back to the radiologists. And we recognize that this industry doesn't need a makeover, it needs a do-over. So we've taken a revolutionary approach to our technology rather than an evolutionary approach to modernizing legacy systems.
We know that radiologists suffer from burnout. We know that radiologists are overwhelmed in their jobs, and it feels like we're wasting their potential by overburdening them with the same tooling that they've had for ages and inability to transform their practices.
Sirona's platform was built and designed for radiology practices of all sizes. Even the smallest practice, without the benefits of an IT infrastructure and a support team, are able to practice medicine in a meaningful way to deliver care to the patients and the communities in which they live.
The data has to be right, the security has to be completely perfect, the access controls and identity management has to be completely spot on, and so fundamentally there's just the bar for how all that has to work together is going to be much, much higher.
It's not just a tech-forward approach, it's not just what's possible, it's what are radiologists actually asking for.
When was the last time any developer has ever asked you what you want?
My first experiences with Sirona, they wanted to understand the problem that I had, and they were with me every step of the way in order to solve it.
From day zero, it's designed to run in the cloud. It's designed to be very fast, very secure, very available, and it's designed to be upgraded with no impact to any of the existing customers that are currently using it.
We're not focused on an algorithm to do this or that. We have built an entire platform to be able to deliver all the best AI that all of tech has to offer.
And the advantages to the customers are pretty profound. When you put all of that new architecture together in one solution, radiologists have new tools, and you also have the ability to add features and functions in a way that's never been done before and at a speed that's never been done before.
The Sirona infrastructure is cloud-based. I need to log into a web browser and I can immediately start reading studies. It has an integrated reporter. I can immediately start dictating studies. I can send back my reports instantaneously.
In order to solve this problem, we had to bring the most talented group of engineers and advisors and folks around this business. And that group of people have built something incredible.
What I'm excited about is seeing a product that physicians are excited to use, which is quite rare when we think about health tech.
This technology has existed to everyone else outside this industry, but not to the radiologist. That was quite surprising for me.
If you look broadly across the technology market, this is actually, it's a difficult, but it's a solved problem, and it's the established pattern for how you actually achieve the best quality software at this point.
We're creating an open architecture that will allow practices themselves, as well as others in the industry, to layer on top additional areas of value seamlessly into the workflow. So it's not just about us, it's about the entire ecosystem being able to leverage this platform.
Deploying AI into the radiology workflow is going to require re-architecting the technology stack in a way that we can add functionality quickly, and we can add it in a way where it's integrated tightly into the workflow. And Sirona is taking a major leap forward in terms of solving that problem.
And you can't solve it halfway and ship it to a customer like most other SaaS products. You need to build the holistic product. Or as we like to think, you can't build 60% of a rocket and fly to the moon.
If I were a radiologist, I would want to be on Sirona's technology. If you're not, you're basically on, it's equivalent of being on dial-up.
Applying all the wonders of modern tech to healthcare, it's desperately needed, and now's the time. And we've built a platform to do it.
I have complete confidence in Sirona because I've seen them each and every step of the way, and they have proven themselves time and time again that they can come up with solutions that were previously thought to be not possible.
You get constant innovation and consistent shipping of new features. All of the innovation that's coming for the next 10 years, 20 years, which nobody else has and nobody else can give you.
When Sirona succeeds, really the sky is the limit.
We invite you to come join us as we launch Radiology Reimagined.
Do you want to be left out of every single conversation that's relevant for the next year with respect to radiology, AI, and computational systems?
We are so excited to show you what we have built.
The future of healthcare has to be practiced through AI-powered, specialty-specific workflows that make physicians more efficient, because they're going to have to be, and more effective. That's what we've built at Sirona. And we hope that by introducing the first entirely new technology stack to radiology in over a decade, that we can help be a part of what we believe is going to be a broader transformation for healthcare. Yes, AI can make this the best decade to be a practicing radiologist. We believe it can make it the best decade to be a practicing physician if we re-architect healthcare IT wholesale so that it can be.